Hello, my name is Dr. Komoshi. I'm a GP at King's North Medical Practice in Ashford. In this series, we talk about common medical conditions that could be treated at home without the need to see the GP. Skin rash is not easy because everything is little red spots, either itchy or not. How can we tell when we need to see the doctor with that? Well, it's not easy, and to be honest, even doctors can't always tell the exact diagnosis, simply because there are so many different skin rashes and they look so similar. But we don't necessarily need to know the exact diagnosis. We only need to know that the skin rash that we are dealing with is not one of the dangerous ones. All the rest will normally go away without any specific treatment. But spotting the dangerous ones is not rocket science. So stay with me. We can find out when you need to see the doctor and when your doctor would be only say to go home and take Piriton. There are two main groups of rashes. One is the acute rash that starts suddenly and spreads within minutes to hours or within a couple of days. And the other type of the rash is what's called a chronic rash, where when the rash is there for a long time or they come back time to time. The acute rashes, mainly two of them we need to talk about today. One is the skin rash that comes with viral illnesses, mainly in children. The other one is the itchy hives type rash that could be associated with allergic reactions. The chronic rashes would be eczema and psoriasis that we cover today. A skin rash that appears suddenly on a young child with febrile, feverish illness, cough, cold, runny nose, is often alarming to the parents and they take their child to the doctor. However, they would have managed the cough cold at home as a viral illness if the rash didn't come. So what is it that worry and fear of the rash? Well, for years it's been drummed into us that a skin rash could be a sign of serious disease like meningitis. Yes, I got it. Meningitis is very serious and life-threatening. However, the skin rash looks quite different from a non-serious viral rash. And most parents also know about the glass test. This rash, for example, is a purpuric rash, which could be from meningitis. You see it's small pinprick and not red but rather purplish, and you see it's not going with the glass test. Well, you might think that this child needs to be in hospital immediately if you didn't know that this is my own little girl on a hot summer day when she rubbed her face vigorously as she was sweating and it got itchy. She was well, no temperature, running around, and just showed me the rash. This time I didn't rush her to the hospital. It was certainly not meningitis. But if an ill child who has high temperature and you notice any rash like this, small, purpley, and doesn't go away with a glass test, you need to take the child to the hospital or call 999. But meningitis is extremely rare, especially since it's the meningitis vaccine is part of the normal vaccination routine. So babies born after 2015 and fully immunized, they are extremely unlikely to have meningitis. So the fully immunized, snotty but generally well toddlers with all different types of spots, rashes, blisters, they don't need any specific treatment. It means that they don't need to be seen by a doctor and the rash could be treated at home. It doesn't matter what the exact diagnosis is. It could be roseola infantum or exanthema subitum. The Latin name doesn't matter because the child will just get through it. If you think that your child has chickenpox with a blistery rash, like this as it starts, or like this when it fully develops, then keep them at home for 5 days from the start of the rash to try to prevent the infection spreading. If it's hand, foot and mouth, which come with similar blistering, there is no school exclusions. However, if the child is unwell, keep them at home. High temperatures with a sandpapery skin rash in an unwell child could be scarlet fever. It's a bacterial illness that could be treated with antibiotics. So probably if you see a sandpapery type skin rash, take the child to the GP. Most parents are capable of diagnosing impetigo, and it also needs antibiotic treatment, either in a cream form or orally. If you're unsure about the nature of the rash, you can always take the child to a pharmacist. They are very good at helping you finding out whether you need to take the child to the doctors. I attach the NHS website below, so you can find out more about different skin rashes if you're interested. The doctors worry more about unvaccinated children because serious childhood illnesses like measles, diphtheria and mumps can start very similarly to another innocent viral illness that we have 6 to 8 in a young child in every year, but they can turn into a serious illness. So if your child is unvaccinated, I would urge you to contact your GP practice and ask for catch-up vaccination to protect your child from potentially life-threatening serious childhood illnesses. Hives and itchy rash is commonly associated with an allergic reaction. Common culprits would be medication and foods. Less commonly, it's something that we inhale, like pollens, and even less commonly is something that comes into contact with the skin, like skincare products or washing powder and things like that. If you suspect that some of these things might be the reason, please discontinue the use of them. You might want to take antihistamines to ease the itching. In the unlikely event of you developing swelling of the lips, the tongue, breathing difficulty, together with the rash, vomiting, severe abdominal pains, or passing out, this could be a sign of a life-threatening illness called anaphylaxis. All these symptoms normally develop very rapidly within about 20 minutes of getting in contact with the allergen. So if you already had hives or a little bit of swollen lips for a few hours, it is very unlikely that it will progress into a full-blown anaphylactic reaction. In case of an anaphylaxis, the most important thing would be to call for help or use your adrenaline auto-injector if you have one. So this table helps to kind of categorize all these rashes. So we have a blanching rash with no temperature. It's unlikely to need medical intervention. You can use emollients and antihistamines. And if there's no improvement with 3 to 4 weeks, please make a routine appointment with your doctor. Blanching rash with high temperature is likely to be a viral rash, especially if there's cough, cold and snotty nose associated with that. Rarely it could be scarlet fever if there is no cough associated. Non-blanching rash with no temperature, again, it doesn't need emergency admission, but non-blanching rash normally needs a routine appointment if the child is otherwise well. A non-blanching rash with high temperature, as we discussed before, it's an emergency. Call 999 or go to the nearest A&E. Pityriasis rosea is a common innocent skin rash that lasts up to 3 to 5 months. However, there is no treatment available or necessary. Now let's talk about the chronic rashes. Eczema and dry skin is a very common condition. Normally, patients are very capable, or parents are very capable of diagnosing eczema. It's red, dry and itchy. First line treatment would be to avoid any soap or detergents, So even if it says on the pack that it's soap-free or designed for eczema or designed for sensitive skin, if it gives you bubbles or foam, it contains detergent and it damages your skin, so best to avoid. You can use soap substitutes, which you can buy from the chemist, and your pharmacist will be able to give you advice on different brands. Frequent emollient use is also advised to treat the eczema. You can have lighter creams or more greasy ointments. The richer, the stronger, the more oily, the better it treats the eczema. However, it's more difficult to tolerate it cosmetically because it's slippery and not nice. Psoriasis is another common skin condition that's there for years, time to time coming back, giving not only skin but maybe nail or joint problems. Psoriasis needs to be treated by prescribed medication. So if you suspect you might have psoriasis, please make an appointment with your GP. I hope that I could help you go through the basics. I know it's still scary and not always easy to find what skin rash you have, but at least you know that most skin rashes are innocent and don't need any specific treatment. If you have any further questions, please refer to the NHS website or make an appointment with your doctor. I hope you will get better soon. Bye.